Neurosurgery is called the Emperor of all specialities by many of us because of the severe complexity and difficulty of most of the lesions of the neuraxis. And like cardiology, where uh, Dr. D. Nornish began the era of preventive cardiology, I think we need to explore whether we have reached the era of preventive neurosurgery. Preventive neurosurgery is the gold standard against which all intervention of physicians and surgeons are measured. And one definition of neurological surgery is it's a medical specialty, and look at it very carefully with the prevention even before the diagnosis, treatment and rehabilitation of the nervous system, including the brain, spine and spinal cord. Now, everybody globally is perhaps unaware of the huge corpus, probably the largest corpus of literature, both on the preventive aspects of medicine, surgery, and all the specialities. And I am quoting from one Chakrapani Datta of 11th century, who was a commentator on the great Charak of the Charak Samhita, the medical component, or probably we could call him the Indian Hippocrates, but he predates Hippocrates by many centuries. The recommendation of medicine are not intended to help someone achieve virtue or dharma. What are they for then? They are aimed at achieving health. So the focus is on health, not just the treatment of symptoms. My mentor, Professor Ramamurthy, for whom it was a privilege for me to write this cover caption in Neurology India, was a pioneer in spine surgery, and he taught many orthopedic surgeons in Chennai, their rudiments of cervical and lumbar disc surgery. He was very, very emphatic that these are, they form a large percentage of the neurosurgeon's surgical volume, and they are all major conditions requiring a lot of skill, obviously microscopes, and in today's current that we follow what is the functional neurosurgery, where we utilize neuromonitoring and precise imaging and localization to decide on the various treatment paradigms in spine surgery. Pain, as God's megaphone, is a terrible instrument. It gets our attention and warns us of danger. And that is true. This is a very, very complex area, and is an area where the neurosurgeons like Dr. Vertosik are, say that we are often baffled, tackled, and sometimes defeated by the greatest adversary, pain. The Neuraxis is the reason we hurt. It protects, but causes the most acute despair like no other experience of human beings. The pain pathways are well known, but still it differs as per each of our patients. The perception of pain has got so many factors, and everyone's pain is different, and some people are not able to tolerate even the minor pain. So pain is without very few exceptions morally and physically a mighty and unqualified evil. And surely any means by which its abolition could be accomplished with security to be joyfully should be joyfully and gratefully be welcomed by medical science. Thus wrote Sir James Young Simpson, a remarkable man indeed. When medicine went wrong, medicine can go wrong very often. And all of us, I have taken this from this book, can be leapers where we create new paradigms and stay ahead. We also all creepers, we go along existing trails of knowledge. Some of us are sleepers, we teach and pass on the known knowledge. And we are also keepers, defenders of status quo. Now, I personally feel that for neurosurgeons, the dilemma is that we need to plan and leap ahead. And like Osler, Halstead, Welch, Kelly, we need to find a new standard, a new definition of how we are going to tackle these problems of this spine in the future. This is a tsunami. Tsunami is anything which is overwhelming and massive. And as you can see, this text neck syndrome or tech neck syndrome. So the epidemiological data indicates that nearly 73% of university students and 64.7% of people who work from home have neck or back pain, and 39.2% of them admit to being less productive due to neck and low back pain. It's very obvious. In fact, most of the patients who walk into our clinic at Apollo have either got neck pain or back pain. And obviously, you can see there are other components of which are instability. And this spectrum, so we will restrict ourselves only to discussing the basic things of neck pain and back pain. Now, this cervical spondylotic myelopathy is the commonest cause of pain in the elderly. It's seen more often in certain professions like people who use drills, swimmers, and also, smoking is a major etiological factor which is causing this deformity. And remember that adult spine deformity is common and is a huge factor in causing this prolapse, because the balance or the curves of the spine are very, very important. So as you can see that you can have this root getting pressed by the disc, and when the disc has prolapsed to this extent, obviously and I personally feel that we should take care of all this and make sure that when we are doing these surgeries, understand all the biomechanics and what is actually happening to the patient's neck or back, and then take remedial measures of correction, especially after exhausting all the conservative modalities of treatment. So cervical spondylotic myelopathy, as you can see, is a spectrum of diseases, a spectrum of disorders, and I have repeatedly written on this topic because our experience is quite large, and surgical management continues to evolve in this. You have so many components to this, both mobile or dynamic causes and static causes, which cause a huge amount of disability. And as populations age, this is becoming very, very significant indeed. OPLL and patients, the overall morbidity in these patients, especially where in diabetics, where this becomes very common. So OPLL, earlier considered to be restricted to the Japanese, is prevalent globally, and it is a major component. We have significant experience in this, and it is a very, very difficult disease. Whether we want to operate on these patients from the front, on the back, or combined surgeries is an ongoing evolutionary process. And it is not only the elderly. This sagittal balance of the spine and the normal curvature of the spine can be a very, very thing. And this procedure, which I really love, is Benzel's technique of correcting the anterior deformity. Edward Benzel has been a great mentor, and this is remarkable. It allows us to restore the sagittal balance of these patients, and as you can see, this is a very, very important way of accessing this. Tuberculosis, vertebral tubercular osteitis, is unfortunately not rare. It keeps cropping up. So every neck pain need not be a cervical disc. So you have a spectrum of pathologies causing this tsunami of neck pain and back pain. And we must be very, very sure that we do not miss instability, and tackle each patient with both dynamic and static. In fact, dynamic MRI is becoming very used modality, especially for cervical spondylosis. So now this neck pain can be due to so many causes. In an alcoholic who falls, doesn't remember the fall, you can have this dislocation, or a very elderly lady who falls off from the bed can develop an odontoid fracture, necessitating this type of treatment. So neck pain can have disastrous consequences if ignored. So this epidemic or tsunami of cervical and lumbar spondylosis, what can we do to make sure that we have the thing? Because the economic costs of treating surgically these, and the number of work days which are lost, is probably in trillions of dollars. So now we need to understand that the treatment from the surgical, where Walter Dandy was perhaps a thing, and we need to know that 70 to 80% of the population, including all of us, in fact, I have operated on my own senior colleague for a lumbar disc, and he is playing tournament level tennis after the surgery. So surgery is very effective, but can we afford to offer surgery to the 70 to 80% of the population? So obviously there is a certain amount of patients who will benefit from surgery. They should get early surgery, they should get a safe surgery, and but the answer is to focus on prevention of the problems with the normal curves of the spine, to make sure that we are able to protect the aging spine, and make sure that we do not have certain. So the etiological factors need to be studied to understand where all we can do to improve try to reduce the incidence of these ailments, rather than doing so. We need to understand that lifestyle, obesity, so this pendulous abdomen, or a weak muscle tone, lack of exercise, poor postures, especially these small children who keep on texting or looking at the cell phone, and children have a large head. So to prevent this, and this having patients with sciatic pain, lumbago, it is every day. Obviously the entire pain is partly due to this huge prolapse, but there are so many, and in these patients, once they have this pain over years, there is a lot of psychological stress which is there. Will I get the pain again? And some of them have a persistent radiculopathy, which I personally feel is much reduced now when we use routine intraoperative neuromonitoring, and where we are very, very careful to do retractorless spine surgery, because earlier on there used to be an instrument described by Cushing himself as a nerve root retractor. We no longer use the nerve root retractors, and this is a book which was presented to me by one of my patients who I had relieved of his excruciating pain. So he sort of presented me with this book, and we need to read this literature and find out how we can prevent the entire tsunami, especially osteoporotic back pain and neck pain, which is very common in the elderly. And we keep on reducing the site of the incision to make sure that we are not creating collateral damage as we access the sign. So minimally invasive surgery is now mandatory in whatever, either it is a microdiscectomy or endoscopic discectomy. And great attention to making sure that we leave the patient much better than what we find. So now, looking back, poor body posture, poor muscle tone, wrong way of sitting, sleeping and standing can have serious consequences and lead to years of discomfort. You can have pain, neurological deficits, deformity, and these require the neurosurgeons to relieve the pressure from the spinal cord, nerve roots, correct the deformity, and fuse the spine using intervention. Now, I would say that all of us, including us neurosurgeons and other specialties, doctors, we need to take care of our own health. We need to sit like a yogi. We need to protect the neuraxis. The spinal column is a brilliant piece of complex biomechanical engineering. When I wrote the chapter, and again I rewrote the chapter for the textbook of Neurosurgery, Ramurthy and Tandon, I realized that the complexity and the progress which has been made in understanding the biomechanics of the spine have been tremendous. So the various curves, muscles, ligaments, discs and bones that surround the spinal cord and roots are prone to injury and can cause lifelong disability and pain. Spine health is central to a pain-free life. Take care of the spine. It has evolved over millions of years to become the highly complex and essential part of all of us. Don't ignore neck pain, back pain or any radiating burn. See a neurosurgeon or spine specialist at the earliest to avoid complications. The key word is your posture and spine sagittal balance has to be maintained and restored in case it has not in optimum condition. So correct your posture, have a good muscle tone, and this epidemic is increasing and causes real huge, so it is worth our while to spend a lot of time in prevention. Do not lift things, heavy things carelessly. Do not bend at the waist, bend at the knees. Don't go to the gym suddenly without adequate toning up exercises. Sit like a yogi. In fact, in old Indian Gurukul system, the first thing the student used to be taught is how to sit well. Next, he used to be taught how to breathe well, and then only the lessons used to be given. So sit unsupported, use muscles and use and exercise your back muscles, maintain the normal curvature of the spine. Don't develop a paunch. This is muscle weakness, and it really reduces the capacity of the spine to maintain its sagittal balance. Tighten your lax abdominal muscles. Dedicated neurorehabilitation under the supervision of a qualified neurophysiotherapist is very important. Careless manipulation of painful and unstable spine can lead to quadriplegia and paraplegia. I have operated on many patients where they were rushed to the emergency after somebody applied traction to the neck and causing quadriparesis and necessitating surgery. Lumbar traction I don't think can cause any traction. It sort of delays the thing, and I personally feel that there is absolutely no role other than for controlled traction, where it is rarely required inside theatre, and there we obviously use fluoroscopy and neuromonitoring when we do controlled traction as advocated by them. So you need to do exercise, and exercise as this video from China, where in an hospital after spine surgery or spine injury, these are exercise is taught to them for nearly up to 8 to 9 hours per day. And that definitely causes a thing. We should not, the KKK syndrome, or the Kai Kal Kodachal, if we translate it, it is hand and leg pain. So a lot of people say that this is psychosomatic, but I feel that this should be the last. Please exclude malignancy, please exclude other causes of pain, and prevention has to have so many things we have to have in mind. So we should not ignore and we should not miss. Definitely we should probably ask them to get another opinion if they need to do this. For example, this non-disc sciatica, which I was fortunate to get 3 consecutive patients who were sent to the psychiatrist with severe excruciating radiculopathy, and they were diagnosed correctly eventually to have this piriformis, and obviously this is a huge burden, especially among the women. So correct your posture, maintain a good body tone, have a very good sagittal balance, sit like a yogi, don't use support to sit, exercise in moderation, maintain body tone, no belts, collars or corsets. They cause muscle wasting, they cause a fixed neck position, so they cause deformity. Chase life. Don't ignore red flags of pain, thunderclap headaches, facial pain, neck pain, low back pain, sciatic pain, brachialgia. Each of these can cause neurological dysfunction. To reduce the incidence and despair these ailments cause, they should be prevented, which is the best possible way. Don't smoke or use tobacco in other forms. Don't drink and drive. This is one of the commonest reasons people land up with neck pain. Don't get drunk, because when you get drunk, you will not remember how you fell. Think first. The hardware, the nervous system is the softest hardware and software in the universe. Protect your brain, spine, spinal cord, and the peripheral nerve. Don't ignore pain. This is a lovely book by Sanjay Gupta, and I would recommend that you explore the options of yoga as brilliantly demonstrated by Sarah Beth. And prevention is definitely better than cure. This 4-volume textbook of neurosurgery, which has just been released, cannot, and there is an important aspect or message sent out in this latest scientific publication, that prevention is better than cure. Thank you so much for your attention.